Hi, Shalom. My name is Avi Dobuler. I'm 70 years old. I live in Beit Shemesh, halfway between Yerushalayim, Jerusalem, and Tel Aviv. Very sunny, as you may see from the lightness of the picture. It is 1 week after my shoulder rotator cuff operation, and I'm sitting in my American Comfort recliner, which is electric, and I can maneuver many different positions till I find comfort for resting or sleeping. A number of things I haven't recorded the last several days because there has not been anything really new appreciably to report to you, and there's one item that's still outstanding that I have not yet reported that I'm going to tell you about now, that you should be aware of, that we have not yet found the solution to. Um, you may notice my hand is swollen still. I do try to manipulate it during the day, squeezing, sometimes squeezing a ball, sometimes squeezing my rubber heart because I love. Thank you very much. That which I found to be most helpful, while I do use the Breg ice water machine on my shoulder, and that's very comfortable, makes it feel really good and takes down swelling, although I don't know how much swelling I have now in this area. It does nothing for the swelling in the forearm or in the hand itself. So we'll put some ice here and there on that area, or some frozen bag of beans, and I'll hold in my hand, wrapped in a little hand towel, a couple of pieces of ice, and that will take down the swelling, but that's temporary. So something here is doing circulation-wise that I hope that with movement ultimately will go down. Another thing that is has come up, and it came up on Sunday. I woke up and felt pressure in my head, not a headache, but big pressure. I took the blood pressure, and the blood pressure was sky high. It was 119 over, sorry, it was 200 over 119, 190 over 115, numbers that, according to Dr. Google, said extreme critical hypertension. Go to a doctor, get medical help, call 911. In Israel, we call 101, which is Magen David Adom, the red Magen star. And we went to the doctor. The doctor saw the blood pressure. By the time I got to the doctor, it had lowered, but it was still quite high. And he gave me a second medication over and above that which I've been taking regularly, that had been preserving my blood pressure at a very good rate, 135 over 75 over 80. And he said, take this medication anytime the number goes over, the lower number goes over 92. I've done that. It has not appreciably helped, and went back to the doctor. We've been going back to the doctor virtually every day, and he recommended even a third medication, which I've only taken once, and the blood pressure is still high. It is not crazy critical, but it's not where it belongs. The lower numbers are still in the mid 90s. It should be lower, but at least the upper numbers are more reasonable. Instead of being 190, 180, 200, it's more in the 150, 155 range. So I hope we find a solution to that. I'm going to be more mobile. I intend to start doing walking. I've started a number of days ago to go to the synagogue, which is down the block. And that's a little bit of walking, but today's intention is to extend that range in a moderate fashion, and to hope that moving around will get the circulation, the blood pressure more in the normal range. The supposition is that the trauma to the body has triggered an abnormally high blood pressure. The doctors don't seem concerned. Of course, it's their body; it's not my body. But I'll go with their uh, way, and also try not to be concerned about it. I'm going to try to drink more between the drinking, the medication, and the walking. I'm hoping that the blood pressure will go back to a regular area. Uh, I went back to the doctor at the beginning of the week, and the bandages were changed. Took a look at it; they look good. I was actually surprised how small the four uh, incisions were where the arthroscopic surgery occurred. Very impressed that they could do that. Really amazing. Um, I've changed my clothing mostly by myself, and something that's delightful is, well, I have not yet taken a shower. I have had my body cleaned off with like diaper wipes or wet wipes, and that's given me a feeling of being refreshed. So the operation, to summarize, is not as severe in pain as I've seen reported. For me, right this second, I have not taken pain medication in a number of days. Last night, at 10 o'clock, I took ibuprofen to see in case there would be any edge of pain, so I at least start to get some sleep. But other than that, once a night to get to bed, I have not taken pain medication since Sunday or Monday, maybe several days after the operation. I wish you all well. I wish you success with your operation. I wish you also low or no pain, and we'll start to move on. Hope to get by the beginning of this coming week. When I see the doctor again, they'll take the bandaging off and they'll cut off the stitches, so that I hope to get an instruction that I can start passively moving the arm or going to getting physical therapy. So I wish you Shabbat Shalom, successful surgery. Saying goodbye, Shalom from Israel. Thank you very much for following. Check like on the bottom and continue to look in and see, so that perhaps you'll have an idea. I found, for me, having an idea from other people's clips on what their experiences were really prepared me. I prepared physically. Here I've got my clock, my eye shades, anything that I need, my tissues, my charger, having a place, a table, a recliner. All these items were super, but also letting me know how people were feeling after the operation prepared me mentally. I was prepared for the worst. I was pleasantly surprised by what actually happened, which was less than was reported by some people. Everybody's experience is individual. If you do not have this experience, know that it's a day or 2 or 3 days away, but with invariance, we're all going through this. We're going through this together, and God willing, we look forward to full recovery as soon as possible with full range of motion. So take care.